Basic clinical skills for 5th semester students of the Faculty of Medicine. Basic clinical skills. Basic clinical skills are essential abilities that medical students must master during the clinical phase of their education. In Semester 5, students begin direct involvement in hospital or clinic practice, where they learn various fundamental medical skills required to provide effective and safe patient care. These skills cover technical aspects, communication, and medical decision-making. Below is a detailed explanation of the basic clinical skills learned in Semester 5. 1. Physical examination. Physical examination is a fundamental skill every medical student must master. In Semester 5, students begin performing more detailed physical examinations under supervision. The process includes the following steps: general examination, inspection, observation, observing the patient's overall appearance for signs of illness, such as skin abnormalities, swelling, or postural changes, palpation, touching, examining the body by touch to detect swelling, pain, masses, or tension in internal organs or tissues. Percussion, tapping. Tapping the body's surface to listen to the sounds produced, which can provide information about the condition of internal organs like the lungs or liver. Auscultation, listening. Using a stethoscope to listen to body sounds, such as heart, lung, and bowel sounds. Systemic examination, cardiovascular system, performing heart examination through auscultation of heart sounds. Evaluating pulse rate, and checking for signs of heart failure or other cardiovascular conditions. Respiratory system, identifying abnormal lung sounds such as wheezing or rales. And assessing breathing patterns and chest expansion. Nervous system, examining reflexes, muscle strength, balance, and motor coordination to detect possible central or peripheral nervous system disorders. Gastrointestinal system, palpating the abdomen, listening for bowel sounds, and assessing for conditions like organ enlargement or abdominal pain. 2. Health education and patient counseling. In addition to technical skills, communication skills with patients are also highly emphasized. In Semester 5, medical students are trained to provide education and counseling to patients about their medical conditions, treatment options, and disease prevention. These include delivering diagnoses with sensitivity. Students learn how to convey a diagnosis to the patient in a sensitive and empathetic manner, especially when the diagnosis involves serious or life-threatening conditions. Providing health education, teaching patients about the importance of healthy lifestyles, disease prevention, and how to manage specific health conditions, such as diet for diabetes or exercise for heart disease. Psychological counseling, supporting patients emotionally. especially those diagnosed with terminal illnesses or major medical conditions, by offering empathetic understanding and guidance. 3. Basic laboratory examinations. In Semester 5, students begin conducting basic laboratory examinations, which involve collecting and analyzing samples, blood sample collection, venous blood. Students learn how to draw blood from a vein. For example, for routine blood tests or glucose level measurements. Capillary blood, collecting blood from a fingertip, typically for quick tests such as blood sugar tests. Urine examination. Students are trained to collect urine samples for analysis, such as testing for acidity, protein levels, or urinary tract infections. Other samples includes collecting stool samples for parasitic examination or sputum for microbiological analysis. 4. Performing basic medical procedures. In Semester 5, medical students are introduced to performing basic medical procedures that are commonly used in clinical practice. Some of the basic procedures taught include injections and infusions. Intramuscular (IM) injection. Students learn how to give an injection into the muscle, e.g., vaccines or certain medications. Subcutaneous (SC) injection. Teaching subcutaneous injections for certain medications. Intravenous (IV) injection. Administering medications or fluids directly into the bloodstream. Infusion. Setting up an intravenous line to administer fluids or medications over an extended period and monitoring fluid flow. Urinary catheterization. Teaching the aseptic technique to insert a urinary catheter, typically for patients who cannot urinate or in certain medical procedures. Wound care. Teaching how to clean and dress wounds using aseptic techniques to prevent infection. 5. Handling emergency situations. One of the crucial skills learned in Semester 5 is handling medical emergencies. Students are trained to provide first aid and initial care in emergency situations. Cardiopulmonary resuscitation, CPR. Students are trained to perform CPR on patients experiencing cardiac arrest. Whether in adults, children, or infants, and also using an automated external defibrillator, AED. Shock management. Students learn to recognize signs of shock, such as hypovolemic or septic shock, and take initial steps to address low blood pressure and prevent organ failure. Trauma care. Recognizing and managing traumatic injuries, such as fractures or open wounds, by stabilizing the patient before transferring them for further treatment. 6. Interpreting test results. In Semester 5, students begin learning how to interpret medical test results, including laboratory tests and radiological images, laboratory test analysis. Students are trained to read blood test results to detect conditions such as anemia, infections, or metabolic disorders. They also learn how to identify abnormal results that indicate health issues. Radiological imaging interpretation. Students start identifying radiological images, such as X-rays, CT scans, or MRIs, to detect anatomical abnormalities, such as fractures, tumors, or infections. 7. Medication management. In semester 5, students begin to get involved in managing patients' medications. They will learn how to plan appropriate and safe medication regimens. Correct medication administration. Students are taught to select appropriate medications based on the patient's condition and diagnosis, ensuring the right dose and route of administration. Monitoring medication effectiveness. Students learn to monitor the patient's response to medications and adjust the treatment if needed, such as changing the dose or switching medications. Chronic disease management. Students begin learning how to manage long-term conditions such as diabetes, hypertension, and asthma, and provide instructions for at-home care. 8. Medical ethics and professionalism. In clinical practice, medical ethics and professionalism are essential. In semester 5, students intensively study these aspects. Professional communication. Students learn to communicate effectively with patients, their families, and other healthcare professionals using clear, respectful language. Respecting patient privacy. Students are trained to uphold the confidentiality of patient medical information according to medical ethics guidelines. Ethical decision-making. Students begin learning how to make ethical medical decisions, considering principles like autonomy, patient's right to decide, beneficence, doing good for the patient, and non-maleficence, not causing harm to the patient. Conclusion. In semester 5, medical students are introduced to essential basic clinical skills that play a vital role in daily medical practice. These skills include performing detailed physical examinations, administering medications, performing basic medical procedures, handling medical emergencies, interpreting medical test results, and communicating effectively with patients and healthcare teams. Students also start learning how to make appropriate medication decisions and develop professional and ethical decision-making skills. All of these skills are designed to prepare students to provide high-quality, safe care for patients in clinical settings.